Recording.
Holy smokes, everyone. It is Kristen Richards. Thank you for your patience today. We try, we practice, we plan, and life, right? Technology, all the things happen. So thank you for your patience. A lot of you are going to catch the recording because there was a glitch between Stan and Zoom, and they weren't playing nicely in the sandbox, but it's all good. We've got the recording. We've got our guests of honor here. And so we are going to jump in. We've got an amazing information share for you. Before we get started, I do want to set proper expectations and disclaimers. While Carla is a nurse practitioner, she is a medical professional, she is not your doctor as of yet, right? We will have an opportunity to connect with her more. But this is not medical advice. This is simply sharing information so that we can better understand this glorious condition. I refer to it as an unruly toddler, lipedema, and we're going to come together, learn from Carla's big, ginormous brain, and just be blessed in the process. So before we dive in, I do have Carla Whorton with us and her daughter, Brandi Graves. I'll introduce Carla in just a second. But Brandi wanted to hop in and tell us one of our guests, Cindy, also has a podcast. I would love for that to be on the recording. So if you don't mind, go ahead and sharing that information. That would be great.
Hi, guys. So yes, the podcast is Stronger Than Lipedema. And we are on Spotify, Apple Music, and iHeartRadio. But I think you could just go to Spotify and just look up Stronger Than Lipedema, and then you'll see mine and Christy's pictures come up.
I love it. Thank you so much, Cindy, for the work you're doing, advocating, sharing information about this. We need to get as loud as possible. So thank you for that.
We sure do. You're welcome.
Thank you. Thank you. All right, ladies, let's dive in. I know Carla is just biting at the grip because she's got so much information. Her dopamine is popping off. And I'm really excited. The wildest connections, right? As we navigate life and we navigate social media, I was connected with Carla through a mutual friend. And I'm not super close with this mutual friend, and neither is Carla, but we truly believe that the Lord had work for us to do and to come together and really use her brain and my platform to get more information out about this condition that most of us fall into the same category as myself. Decades, close to 4 decades, I did not understand my body. And if we can help not only ourselves, but the upcoming generations manage and deal with and eliminate the shame, the gaslighting that goes along with this condition, I'm all in. I'm all in, and I won't stop yapping about it. So, Carla, thank you so much for joining us. I do have some of your bio. Let me just pop up some of that. It might just give us a quick little recap. I know that you've transitioned and now you're treating lipedema women, but you have quite an extensive background.
Yes, I do. I have been an ICU nurse, CVICU, rapid response stroke, for 31 years. Wow. And I've seen the end stages of a lot of the diseases. And I've been a nurse practitioner for 5 years. And at the same time, I got my certification via A4M. And can you still see me?
It's
we can see you.
Okay, I'm going to put my phone on airplane mode because it just, I don't see the big picture. I got a call and it switched me off. So let me put my phone on airplane mode. Maybe that won't do that again. I don't see the big picture. I'm just saying all the ones.
You're good.
Okay, but I was working in California and I was working my 12-hour shifts and busy with life when Brandi developed lipedema. And she didn't know what it was. All of a sudden her health condition changed. And it really scared me, but I didn't know what to think of it. And she researched on her own, just like most people with lipedema do. She did all the research by herself. But then later I started doing deep dives into lipedema. And when I saw Dr. Herbst's video on compartment syndrome, and I realized how that lipedema is compartment syndrome, it scared me to death, because I thought, we've got to get a hold of this, you know. So because I had had patients with this admitted to the hospital with cellulitis due to compartment syndrome. And but they didn't know why. And I would look at these patients and say, why? I would think to myself, why did this happen? And that just made me have a really big reality check. And I started doing my deep dives into lipedema. And that is when I knew that this is what I wanted to treat as a nurse practitioner. And but if it weren't for Brandi, I would know nothing about it, because she's always been a researcher. She might kill me for this, but she's 1 point less than genius. And I never let her forget it. That's a fact. They tested her right out of kindergarten. And they said she can read and absorb this much material while everyone else is doing this. And she's always done that. She had just done all of her research. And she taught me, then I did my deep dive. And so I'm going to let Brandi, she wanted to say something, so I'm going to hand it over to her.
Well, yeah, I thought that I would just give my typical spiel. If you've heard this before, because you're in our group, or you've messaged me before, but I usually tell people that have recently been diagnosed with lipedema or who are having a hard time, you know, I usually tell them three things. And I just want to give a little bit of hope, because I know we talked to Kristen a little before the call, and a lot of women are you know, in a really bad state because they're trying to figure all this out. And I've been there in my early 20s. A lot of days couldn't get out of bed. I had viral flare-ups all the time. And before we did a lot of the stuff that Mom is going to talk about, and I learned how to handle it from a naturopathic and a functional standpoint. You know, I was bad off. My joints hurt all the time. I had to get massages every week just to, you know, work the knots out. And I was really sick a lot, and I had to sleep a lot. And so if you're there, you know, I understand, and things can get better. But first, I like to sort of give a reframe to lipedema, because it gets a, you know, really bad rap, and there's a lot of things we don't like about it, right? But after I read this book, it's I don't know if everyone can see it or if it's turned away, but it's, you know, spelled like the lipoedema way, like they spell it overseas, but it's called Lipoedema, an Evolutionary Mismatch. And the Dr. Ahmet that wrote it, he's from Turkey and he practices in Turkey. He does the lipedema liposuction. And he talks about how in this book, really, it is a evolutionary good thing that lipedema developed, because we kept the population going during times of famine, and we could ovulate when no one else could ovulate. So chances are your great grandmother 100 times back really helped the population keep going. And none of us might even be here if it wasn't for lipedema. And so really, instead of looking at it like this horrible genetic thing, there was a really good reason that it came about. And in fact, if you Google African fertility goddess, you'll see that she has lipedema. You know, so women that had lipedema were worshipped for their fertility. And it never fails. Someone, if I post that in a group, someone's like, but I had to do IVF at 35. And I'm like, right. But back then your grandmother was having babies at, you know, 14, and you probably could have had a baby at 14 too.
So we'll get into those reasons why.
Yes. So we keep the population going. So if you know, I'm all about looking at things, reframing things, instead of like hating ourselves, hating our bodies. It was a really good evolutionary thing that it happened. And the second thing I want you to think about is, would you actually change? Like, someone asked me this a while back. They said, wouldn't it be great if there was a machine that we could all go through, like an MRI machine, and we come out the other side like a tunnel, and we have no connective tissue disorder anymore? And I thought about that, and I thought, you know, I wouldn't do it. And the reason is because even though I have, and the list of all my things goes on and on, but it's like, you know, I have the histamine intolerance, the mast cell activation disorder, the Ehlers-Danlos, the fibromyalgia, the TMJ, the subluxations, the adenomyosis, endometriosis, fibroids, the cardiac issues from the sinus tachycardia, POTS. I have a leaky heart valve. immune deficiency and chronic sinusitis, chronic viral infections. All that to say, you also can have a very high IQ when you have Ehlers-Danlos. There's an association there. And a lot of women in the lipedema community have a very high IQ. That's the whole reason I'm bringing this up right now, because even if you think you don't, if you went and took an IQ test, you would probably have a much higher than average IQ. And I thought, no, my brain has been my superpower in life, because, you know, Lord knows I can't carry a tune in a bucket to be musically inclined, and I was never going to be a star athlete. But I've been an entrepreneur since I was 18. I graduated college at 20. You know, I've run 2 or 3 businesses at a time since then, and, you know, getting my master's degree in finance right now. And I'm like, and, you know, we need a high IQ when we have lipedema, because you've got to learn all the things to figure out about yourself. And a lot of times you might know more than your doctor does about, about things, and you're probably the one educating them a lot of times. But you know, think about that, because there are things that you probably really like about yourself that stem from the same root cause as the lipedema does. And you know, a lot of women have great skin in the lipedema community because we produce too much collagen, you know. So it's like, you know, I don't like a lot of things about the connective tissue disorder. I don't like the black circles around my eyes from the histamine intolerance, and I don't like the lipedema, but there are things you probably wouldn't change about yourself if you could, because of the same root cause. And so I want everyone to think about that. And then the third thing I always tell women in the lipedema community is that my fella Tony actually turned me on to this, but it's my favorite definition of self-esteem. It's from Nathaniel Brandon. And he says that your capacity to know that you have the ability to handle what comes your way is his definition of self-esteem. And I love that definition because it has nothing to do with external factors. It's everything internal. It's trusting yourself that you can handle whatever comes your way. And I thought that that would be a good way to segue into mom's talk, because you're going to learn a lot of things. And at first you might think, whoa, that goes over my head. But you have the recording and you have Google, and you can look things up that she's saying. And you're like, okay, I can handle this. Because if we as lipedema patients get our self-esteem from external factors, then we're not going to be in a good mood every time we get up and we can't fit in our jeans and we're up 3 pounds because of bloat, and the list goes on and on, right? And we notice a new pocket of lipedema has formed somewhere. So I prefer to just say, you know what, my self-esteem comes from knowing that I can handle whatever comes my way. And if you're in a place right now where you feel very sick and tired and achy and you can't get out of bed like I used to be most days, that might just be doing little bitty tiny things at a time. So don't be overwhelmed, and just take what resonates. Whatever mom says that resonates with you, look into one little thing at a time and save the recording and listen to it again and again and again until you implement more things.
Brandi, that's beautiful. And if you don't mind dropping that book in the chat so that everyone can pick that up. I have not read that, but I love that change of mind, that reframe of mind. And the IQ, I mean, it's such, because initially you'd say, yes, I want skinny legs, right? Or I want skinny arms.
Right.
But to know and to think about it in a different capacity. So thank you so much for that reframe. That's beautiful. Thank you. Thank you.
You're so welcome.
I don't want to take any more time. I know Carla's got lots to share with us. So Miss Carla, you go ahead and take it away. We're going to do your info share.
Okay. Great. So I do first want to thank God for where he has led me today, because I would have never thought I would be doing this, but we went through these personal things. I've had my professional career seeing the end stages that I'm trying to prevent, but all along that I was doing my education as a nurse practitioner 5 years ago, I was also studying with A4M, which is the anti-aging American Association of Anti-Aging Medicine, A4M, and that what they do best is hormones. And at that time I was learning it, but I did not even think that was the direction I would go. But after learning about lipedema, And one of my patients says, this is a beautiful conglomeration of yours and your daughter's health history, plus your professional history at the bedside, and bringing it all together with my education at A4M, and it ties it up in a nice little bow. And now I understand everything that has been the matter with me from the time actually I was in the 3rd grade. I knew that I did not have a lot of energy, and I would go to sleep at my desk. So then I knew everybody else is running around friendly, you know, trying to control the teacher, trying to control them. But the minute I sit down, I go to sleep. And then in my teens, I started studying what will give me energy. And back then we had to go to the library and research it. So I started taking B12 as a teenager to try to have energy. And then as in my 20s, they came out with a SAMI, and I started taking that. And I didn't know at the time that what I was reaching for and what I was doing was addressing a genetic polymorphism we had. And that genetic polymorphism will bring us into our first topic, which is dopamine. But first, I want to say that it's well known, and everything you read about lipedema says it occurs at times of stress or hormonal changes. But that's all they say. That's where they stop. So today, I'm going to hit on these things, and I am going to tell you my theory of exactly why that is at every stage, at puberty, at premenopause, and the premenopausal woman does not know that there's anything going on with her hormones, but there already is. And then I'm going to take it into peri and postmenopause. So we'll see at each age why these things occur. And I've Googled it and Googled it. And this is where my education with A4M comes in, because they don't focus on just the hormones, they focus on the metabolites of these hormones. And I will show you these on the Dutch test. But when we think about hormones, we have to think PTSD. That's the P is for the production, and I add the supplementation of these hormones. We have to have that. And as we get older, it is the supplementation. But the T, it stands for transformation to the receptor site. We have to be able to transfer them to that receptor site. Every hormone we have, whether it's cortisol, insulin, whatever we have, it has to have a receptor site to do its job. And Dr. Lee even refers to it as the hormone has to sit on its throne. So we'll use that too. I love the throne. But the S is the sensitivity of that receptor site. And if there's toxins in the body, or even synthetic hormones. When I talk about hormones, I'm definitely never recommending synthetic hormones, not synthetic medroxyprogesterone or synthetic estradiol, never synthetic. Those hormones were the ones that were studied in the 90s, and that report came out in the Women's Health Initiative study in 2002 and literally scared everyone to death to do hormones at all. Naturopathic doctors, functional medicine, and these kind of professionals knew how to read the data, and they never took their patients off of their natural hormones. Natural hormones, bioidentical hormones, are chemically and structurally identical to our own. So they can sit in that throne and they can do their job. And not only that, they communicate with the thyroid hormone. Progesterone communicates with estrogen and testosterone. And so they give full messages to balance. What we want in our body is homeostasis, and that's balance. So then we get to the D. Detoxification, PTSD. Detoxification in our body of these hormones is mandatory. We have to use them and lose them. And synthetic hormones hang around in our body for days and months. And Premarin actually causes the buildup of one of these toxic pathways that I'm going to end up showing you. And so we always, we have to think PTSD. We have to think use them and lose them. And I'm going to get on to my, the two great definitions of hormone. So Dr. Bigman, he's on YouTube. I listened to his video a couple of years ago, and he said, and I never found this anywhere else, that lipedema is caused by a sinister pathway of estrogen that causes the release of transforming growth factor beta, and that actually TGF beta is actually a hormone that comes into play with even modeling in a normal sense. It helps our body form, but it's also involved in several areas of fibrosis in our body, even pulmonary fibrosis. And this is where what I've pulled up. This is what causes fibroids, because the transforming growth factor beta causes the release of fibroblast growth factor, which causes the collagen bands in the lower body to fibrose. Some of the fibroblasts transform into the myoblast. And think, when you have to have your fibroids removed, it's a myomectomy. So that is what causes the overgrowth and fibrosis at different places in our body. It's also another description from an article that I pulled up is really good, is an adipofacial disorder that almost exclusively affects women. It leads to chronic pain, swelling, and other discomforts due to the bilateral asymmetrical expansion. And we all know that, but it leads to hyperproliferation of fat cells, fibrosis, and inflammation. And of course, it hasn't been fully identified, but he does say it's a connective tissue disorder with a loss of elastic recoil, allowing release of the transforming growth factor beta. But what this causes, just picture this. We've got these compartments, and inside these compartments, we have got fat cells. In this compartment, fat cells and fluid. And because of the negative ion effect in there, it pulls in more water. And this can't get out. It's in there and it can't get out. And I'm going to show you a fat cell. Now, I'm going to show you a normal and an abnormal fat cell. So I'm going to show you this. The fat cell on the left is a normal fat cell. This is described as just like a drop of oil.
Hey, Mom, back that up just a little bit, because it's too close in. Just hold it just a little bit back.
Okay.
There you go. Yeah.
Can you see that now?
And up just a little. There you go, right there.
Is that?
Yep.
Okay, right there. Okay, the one on the left is a normal fat cell. The one on the right is an inflamed fat cell. This is called inflamed white adipose tissue. And what you've got in the middle is a little crown. But this inflammation can be caused by stress. It can be caused by stress in your diet. It can be caused by emotional stress, physical stress, and we're going to get into that. But what happens when your body is under stress and insulin, too much insulin, when you eat carbohydrates before protein, will actually cause this inflammatory cascade. So the one on the right is inflamed. And what can happen with this, get a view of this, because I'm about to pull it away. Inside this is necrotic tissue. So inside those bands, this is a fat cell with necrotic tissue. This can rupture. And I Googled the lipedema fat cell, and it's the very same description as this. It has the necrotic crown in the middle. But what happens is you have an inflammatory cascade in there. You have COX-2 expression. You have prostaglandin 2 expression. And PGE2 is the strongest stimulator of aromatase. So when you're under stress, you aromatase your testosterone. Even women have testosterone. So this comes into play. the testosterone is aromatized into estrogen. And this is what happens. We need our estrogen, but it needs to be balanced. But every time we're stressed, we're aromatizing our own testosterone, which we need, into estrogen. This causes estrogen dominance. Estrogen dominance causes weight gain. It can put you at risk for other diseases such as breast cancer, uterine cancer, and other diseases. So the first thing we need to do to control lipedema is to realize that that stress is a contributor. The first thing, though, is the genetic predisposition. Now, they've identified some things like AKR1C1. Now, that's been identified associated with lipedema, but there's also genes that can cause lipedema in an indirect way, like methylene tetrahydrofolate reductase. That is the gene that Brandi and I have. And when I found that out 15 years ago with my naturopathic doctor, I had breast cancer at 29. I had been to the doctor. It was 23 years later that finally a doctor got my history. And I didn't know I had lipedema in my 20s, but I did have lipedema in my 20s, and I starved myself because I was trying to lose weight, and that leads to stress on your body. So we need a balanced diet. But all of the stress also causes a reduction of progesterone. And when our progesterone goes down, it causes estrogen dominance. And we'll get into that just a little later. But
hey, Mom. Also,
yeah.
I just wanted, while you get a sip there, we had a discussion recently in the Lipedema chats group about how some women don't resonate with the whole estrogen dominance concept because they know that they have high testosterone and low estrogen on a blood test. So can you just repeat what you said again, that even if you have high testosterone, that it can convert to estrogen, just so everybody understands that if they're going, oh, I don't have estrogen dominance because I have high testosterone, just sort of on that point.
Well, that's actually where we get our estrogen. Estrogen, testosterone does convert to estradiol anyway. And that's why, just think, you can picture this. How many men do you know when they get older, they go bald and get a big belly?
Yep.
That's estrogen dominance. They still have estrogen, but their testosterone has gone down low. And if we don't stay balanced as we get older, that's the same thing that happens to us. That's why it happens like when you are 25, and this is what was going on with Brandi and I, probably at a very young age, because if I got breast cancer at 29, they said that that had to have started growing at 21 for it to have been so big at 29 that I found it. Okay, so how long had that estrogen been building up at the cellular level for it to even start growing at 21? It had to have started at puberty.
Yep.
And with Brandi had endometriosis at 21. If she had that at 21, how long had that been affecting? It didn't just start overnight. It had to have been at puberty for that to, but been so bad that she had to have surgery, and it was all in her abdomen. That had to have started right at puberty. So this MTHFR gene prohibits the breakdown, the detoxification of estrogen. So right when we hit puberty, our and my testosterone had to have been high, and Brandi's too, because too much testosterone causes acne.
Right.
So when we first hit puberty, our testosterone was exploding. And when you're in puberty, your hormones are going every which way. You don't know where they're going to land. So that causes PCOS, polycystic ovary. Okay, so then as we got a little older, all that testosterone converted to estrogen and could not be detoxed. And so there I got, and at 25, then naturally my progesterone started going down lower anyway, because the precursors of progesterone are the same as the precursors of testosterone and progesterone. So your body, when you're in stress, your body doesn't know if you're trying to save your life from a lion or if you're just stressed because you're fat. Your body doesn't know. And so you're going to start making cortisol. Cortisol makes your insulin go up high. So see, this is why all of these hormones are together. You can't just look at lipedema, because every single hormone in your body, they either function together or dysfunction together, like a dysfunctional family. So if you're under stress, you're making more cortisol, and I'm going to show you the diurnal cortisol curve a little later. But when you're stressed, your progesterone's coming down. Estrogen dominance happens when your progesterone is going down for any reason, either naturally, either from stress, and that estrogen is still way up here. Your progesterone is way down here. Estrogen dominance. Estrogen is a proliferator hormone. It wants everything to grow. Think about your uterus. You're trying to get ready for a baby, but this estrogen is way up here. It's got this aromatase. The purpose of estrogen is to put fat on your body. Among many, many other great things it does, and we need estrogen, but it needs progesterone to control it. One of my instructors say our progesterone is our policing hormone. It's going to control this estrogen. It's the progesterone is here saying, I want that fibrosis to grow in that breast or in that uterus, and the progesterone is saying, no, you don't. No, you don't. I'm going to control you. And so all of that is what's going on in I said, what's going on at premenopause? And she made fun of me and said, oh, we're all in premenopause. You can't take it lightly. And that's why it's so dangerous, because all these changes are going on in our daughters. They were going on in me. They were going on in Brandi. And if I had known what I know today, I would have started Brandi out on the Dutch test, have monitored her hormones so I could see exactly the levels, and I could see exactly how she's metabolizing them. And we see different paths of metabolizing, and we'll get to that a little bit later. But getting back to stress can be caused, dopamine. Our dopamine is our motivator hormone. That's where we get our motivation to get up and do things in the day. And our dopamine can actually be damaged because of childhood trauma, and it could be damaged the rest of our lives. And we can do things to hack our dopamine, and Andrew Huberman has a great one on that. And but our dopamine is also what controls our dopamine reward pathway. Okay, so what I learned last week is that dopamine also controls the permeability of our blood vessels. I didn't know that. And dopamine, I started looking back at my lipedema patients, and I know my dopamine is low and Brandi's is low. On the Dutch test, 3 is the bottom level. But my dopamine, I've known, that's why I went to sleep at my desk as a child. That's why I did not have energy as a teenager. That's why I have ADHD. Low dopamine causes these things.
And
but there are
one lady even said narcolepsy in the group. She said she had low dopamine and narcolepsy. So that might resonate with somebody on the webinar.
Yes, that does. I've been diagnosed with narcolepsy also. And because dopamine and narcolepsy, I think it's like 25% of the people that have ADHD and they have low dopamine, they do have narcolepsy. And I've had to apologize so many times if I was a nurse manager of ICU with Kaiser, and we had to go to this class to learn how to do the fit testing on our ICU employees. And we ran over there. I was just zooming. We sat down in the chairs, and I'm like this, head dropping. And she said, "I'm sorry, this is so boring." I said, "No, it's not you, it's me." But you literally cannot stay awake. And I've had and working 12-hour shifts as a nurse, I never sit down. Even working not all night long, 12-hour shifts, and my coworkers know I'm never going to sit down. And here I am, 68, and they're sitting down at the desk doing their jobs. And no, I can't. They know. I said, "Well, if I sit down, you'll be answering all my call bells because I'm going to be asleep." And but that's something that I did not know I had. But as I grew up, and I was a reader. I read a lot. I learned that I absolutely love to read, even in the third grade. And I read all of our books, and I would go to the neighbors and say, "Hey, have you got anything I can read?" Even if it was a cookbook. And hey, cooking those cookies, that raises your dopamine too, the smell of those cookies. But then as a teenager, I found exercise. And I knew, and even when my kids were growing up, they knew wherever we were, whatever. And I hated to do it because I would have loved to have stayed in, even on vacation, because their dad liked to cook a huge breakfast. Now I knew that I had to get out and run. And I didn't do it selfishly. I knew that if I didn't get out and run, my kids would not get the best of me that day. But I didn't know what was the matter with me. But every single day, I was looking for the things that would optimize me. And that's what my goal is, to optimize people, because there are several hacks that you can do to raise the dopamine. And I do those. Cold water on my face the first thing I wake up. Walking, the first thing is thank you, God, that I'm awake today. That gets your oxytocin going. We hack our hormones. And like Brandi said earlier, the sniffing, and she can, or the sigh. So then I come down the hall and I do 60 jumps on my rebounder. And before I even get my coffee, I've already done 60 jumps on my rebounder. That gets your dopamine up. Then you go to get your coffee and go outside, the sun in your eyes. That gets your cortisol and your dopamine. And we'll talk about the diurnal cortisol curve in a minute. But if you don't have, even if you know what to do in your day, I plan to eat right today. I plan to exercise today. If you don't change the chemicals in your brain, you can't even do what you intend to do. The night before, intend to get up and have a good day. Raise your dopamine levels. And there's something else you can do to raise that also that we'll talk about in a bit. But low dopamine can actually cause stress in our body because we don't know what's the matter with us. And we're trying to accomplish things in our day, but we're ADHD and our brain gets scrambled, and that causes stress. That can cause that reaction in our body that aromatizes testosterone into more estrogen and causes that inflamed adipose tissue and emotional stress. And what teenager is not under emotional stress? New boyfriend, first love, they break up. She's under all this stress. And then her hormones are going crazy anyway. And that's still going on in our 20s when we're trying to settle and choose a mate. And plus we exercise a lot. Viruses, infections, all of these things cause the very same inflammatory cascade as, just think about COVID. I don't know how many of you heard about cytokines. When they would talk about the cytokine storm, that is the inflammatory cascade. Well, we wouldn't give ourselves COVID, would we? So we have to learn to deal with our stress, because whether it's going to a therapist or whether even more, even further, and I'll tell you how important this is. So I took some of the alternative cancer classes through A4M. And what they talked about, well, the first video was on insulin levels. We have to control our insulin levels. High insulin levels causes this to happen immediately, okay? But what they said, what one of them was an alternative oncologist, and she's actually an instructor here at one of the naturopathic colleges. She had 9 patients that had cancer. Their doctor told her that told them they only had 6 months to live. So she wanted to do an experiment. So she wanted them to go to psilocybin therapy. And I don't know if y'all are aware of this, that all over the country, they're doing experiments in just about every state. They're studying it. And it has had so much progress with our frame of mind, with our well, there's fantastic, even Huberman has a fantastic, look up Huberman and psilocybin. He calls it neuroplasticity. If we have trauma as a child, and that is with us, or even trauma as an adult, we have stressors, things happen, and we think we're doing okay with it, but somewhere deep inside, we're really not. People that went through this psilocybin therapy, 10 or 14 years later, all but one was still alive. After going to psilocybin therapy and having the neuroplasticity in your brain, it completely helped them to accept their trauma. So if you have trauma or anything that's causing you stress, that's causing you extra things going on, and I actually know a guy that did this, and he said that during this therapy that he cried, all of these things from his childhood came out, and he cried as if it was just happening, but he was a totally different person afterward. And but things can stress our body, such as food sensitivities. And food sensitivity testing can help with this. Most of the time, people have food sensitivities, such as dairy and bread. You know, they're the highest ones. Brandi and I went gluten-free and for the most part dairy-free a long time ago. But there are testing that can make you put on water, and the stress of it, the stress of that sensitivity can also start this inflammatory cascade. The micronutrient.
Also, let's just give tips too, because if someone wants to, they can do the testing for food intolerances. But if they can't do the testing right now, my sort of go-to is just to pay attention to how your body feels after you eat. And a lot of people assume they don't have food sensitivities because they don't have gut issues, which is what I always thought. But the way that food sensitivities show up in me is I get brain fog and I get post-nasal drip. And then my histamine intolerance shows like under my eyes, my under eyes will get black. And that's what Dr. Ben Lynch says too. So if you get little micro tears in your mouth after eating something, sometimes we'll eat something that'll kind of irritate the lining of our mouth or make our throat a little itchy, or we kind of have to like, start clearing our throat. Those are all signs that you're probably sensitive to what you ate.
Very good. Thank you, Brandi. And we might can tell because the next day we're a couple of pounds higher because we retain fluid from
That too. And that book on food sensitivity says that you will retain a half a pound to 2 pounds per sensitivity because your cells are trying to retain water to cool off. And years before I ever knew I had lipedema, I did a food intolerance test with our naturopath, and I was intolerant to 32 things. And I lost 20 pounds within like 3 weeks, even though I wasn't counting calories. And again, should have been a clue I had lipedema. But I wasn't counting calories or carbs or anything like that. She just said, we're going to try to heal your gut and you don't, have these foods. And it was random things like vanilla or black pepper, garlic, in addition to the big ones like the eggs and the dairy and the gluten. So that's important to keep in mind. If you have swelling and you don't know what it is, it could be a food sensitivity.
Yeah. So all of these can contribute to our inflammation. And too much alcohol, of course, and then plain old inflammation, like we talked about earlier, such as viruses and stuff. But gut issues, sometimes we have gut issues and we don't know that we have them. And that is a biggie. But then we come down to our blood vessel integrity. Now, any of the things that we just spoke about can cause us to look the degradation of the blood cell lining, and the blood cell inside between the epithelial cell lining and the wall of the artery is the glycocalyx, and it is held together by tight junctions like this, tight junctions, and the inflammation with food intolerance, with all this stuff, it pulls these tight junctions apart, and this can happen in your gut also with stress. And what is released is zonulin. Zonulin can be released into our system and the tight junctions. And why this is important is that, of course, this causes more fluid to leak out into our lipedema cells and into our compartments. This can cause the retention of more fluid in there. And remember, when the fluid gets in there, it's hard for it to come out. And this can also be caused by hormone imbalances. This is one cause of a lipedema occurring at times of hormonal changes. When you have hormonal imbalance and premenopause with the progesterone, because actually progesterone is a sticky hormone. Progesterone inside the gut wall, while we have it, is a sticky hormone, and it causes these cells to stick together just like this. And it causes the upregulation of a sticky protein called occludin, and it holds it together. When we start losing our progesterone, these can come apart, and that's where a lot of autoimmune issues start at around 30. I can think of several young girls right now that started developing autoimmune issues because of that. Same thing with our blood vessels. And if I were to Google that, that made me think of one question. Okay, is the progesterone, and it must be because, and I actually have all of the citations for everything I say. And this was one of my instructors, and she had been an interventional cardiologist for over 20 years, and then went into functional medicine. So she's talking about the glycocalyx of our blood vessels. She knows what she's talking about. And she said that going through premenopause, peri, and menopause, that we can lose our blood vessel integrity. And I bet you $2 it's because of the loss of that sticky hormone, progesterone. And it can also cause gut dysbiosis and the HPA axis dysfunction. And I'm going to start talking now about the phases of life. And we're going to start with premenopause. And as my friend said, yeah, we're all premenopausal. I wasn't, I was post. But puberty, like I said, they're just going every which way. We don't know where they're going to land. And we start, it started out with us, obviously, with too much testosterone. Then it got aromatized into estrogen. And then we started having all of these diseases that are caused by estrogen tolerance. And I'm going to show you a Dutch test, and I will show you that. But in premenopause, at about 25 to 30, our progesterone starts coming down. And one of my instructors actually calls it progesterone, nature's Ativan. She calls it the Goldilocks hormone, because this is what happens. You start having insomnia, and insomnia, progesterone actually acts on our GABA receptors in the back of our brain. And if you're familiar with those, the GABA receptors is what makes you go, ah, and helps you go to sleep at night. So we start having insomnia. And these estrogen dominance can be caused by our natural decrease of progesterone, but it can also be caused from too much testosterone. That's obviously what was the matter with me. I had too much estrogen. I could not detoxify it. Then I got pregnant with Brandi. Okay. When you get pregnant, your estrogen is at an all-time high. And it's proof because progesterone, think of that word, progestation. It holds that embryo in the uterus. And if women have low progesterone, it might be fertilized, but they're just going to pass it because they don't know they were ever even pregnant. Because if they don't have enough progesterone, it's gone. And I started bleeding when I was pregnant with Brandi at about 2.5 to 3 months. And of course, the doctor said, just stay in bed, don't work, stay off your feet, don't go under, don't be stressed. Well, now I know why. Because if I was stressed, I would be making too much cortisol. My progesterone would go down farther. I had always heard that, by the way, but that explains it. But progesterone is it balances estrogen and it keeps everything straight, but it also affects our thyroid hormones. If we have low progesterone, our thyroid hormones are not going to work accurately. Even if our TSH says it's okay, there's other things that are going on and we might not. And one thing, if you're under stress and your cortisol is high, well, if you have hypothyroid, a doctor might put you on a synthetic thyroid medicine, which is T4. The Synthroid is nothing but T4. But if you're under stress, your cells still can't use it because T4 has to be converted to T3 in order to be used by the cell for energy. So if you're under stress, the T4 cannot convert to T3. And if it does, it can throw it back into reverse T3. So you've still got a problem. So a few things that progesterone does, I'm just going to go down this list real quick, and I'm going to, of course, it has a positive effect on sleep, but progesterone is anti-inflammatory. So we've been talking about inflammation. Progesterone is an anti-inflammatory. It helps the body use and eliminate fats. So if our progesterone is low, we can't use and eliminate our fats. It acts as a diuretic. So we start retaining water. And this list comes from one of my instructors, Pamela Smith. She wrote a book, and you can get it on Amazon. Everything you need to know about hormones. It aids in ovulation. It balances estrogen. It actually induces conversion of E1, which is estrone, to an active form of E1S so that it won't be harmful. It helps build bone. It maintains bladder function. It helps prevent anxiety, irritability, and mood swings. So that's a big one. We're having anxiety, irritability, and mood swings. What's that going to do to our cortisol? It actually increases scalp hair. So some women, 30 to 35, what's going on? They can't sleep. Their cortisol's going up. They start gaining weight. They start getting a little bit irritable. Progesterone modulates oxytocin receptor binding in the hypothalamus, which is our love and bonding. Okay, it's involved in our immunity. It actually protects breast health. There's research done on women that had breast cancer, and this is huge. Okay, there's research that worked great, that people that actually had breast cancer, if they gave them a huge dose of progesterone before their lumpectomy or mastectomy, it extended their survival just because of that high progesterone. And because it is protective of breast tissue, it's actually protective of all tissue. A good balance of progesterone and estrogen actually prevents colon cancer. Hormones get such a bad rap, but this is what's going on. Okay, it supports the immune system, helps promote implantation of the egg, and it actually promotes the formation of the myelin sheaths of our nerves. And I'm talking about natural. Of course, I have to keep saying that. Okay, it starts going down at 25. And then we start having all of these symptoms. And I've got my notes here, but I've already gone around this. By the time we're 35, our progesterone is only half what it was when we were 25. And I have friends, and I have a coworker that had just lost a baby, and she was 35, and the doctor said, "Oh, well, you've got low progesterone. Why don't they do these studies before that?" That's my complaint. We've had, and disenchantment with our medical system is another reason I went to this. So the symptoms of low progesterone include interruption of our diurnal cortisol curve, and pain and inflammation, osteoporosis, excessive and terrible menstruation, hypersensitivity, migraine headaches before cycles, decreased libido, and actually decreased HDL, which is our good fat. And this is a very interesting study. They measured blood levels of progesterone in almost 6,000 women that were premenopausal. Women with the highest levels of progesterone who had regular cycles had an 88% reduction in the development of breast cancer. And that came from Pamela Smith, and she has her citation there. In another study of 1,000 women, they were studied for over 30 years they were undergoing treatment for infertility. The trial was done to look at subsequent breast cancer risk. Women who were deficient in progesterone had a 5.4 times increased risk of developing premenopausal breast cancer and were 10 times as likely to die from any cancer. That's huge. Testosterone also takes a nosedive at this time, from 18 to 34. Herein lies more anxiety, sometimes panic attacks. We're losing that alpha self-confidence that our men have at this age. Testosterone keeps us lean. We start gaining weight when we lose it. And if you have a familial genetic predisposition, then it's going to occur even more. This comes from Dr. Landa. Testosterone is actually the most abundant hormone in the female body, 10 times more abundant than even estrogen. The biggest drop occurs at that age, and even in England and Australia, they start giving testosterone to women really early. Receptor sites for androgens are located in almost all tissues, including breast, heart, blood vessels, GI tract, lung, brain, spinal cord, peripheral nerves, uterus, ovaries, endocrine glands, vaginal tissue, etc. But we need testosterone also. Testosterone in women increases the sense of emotional well-being, improves depression and anxiety. It helps maintain memory. It helps keep skin from sagging, and it decreases excess body fat. We need our testosterone. All of these are great reasons that we start, that lipedema will occur at times of hormonal changes. Peri and post-menopausal. So we all know the usual symptoms: hot flashes, anxiety, weight gain, and here's lipedema, nervousness, migraines, painful sex, fibroids, endometriosis, loss of memory, vaginal dryness. And we all know all of this, but we don't know what estrogen really does for us. Estrogen stimulates the production of choline acetyltransferase, which is an enzyme that prevents Alzheimer's disease. It increases the metabolic rate. Here's another reason that lipedema might start at that time. It helps improve insulin sensitivity and prevents diabetes. It helps prevent muscle damage. It helps maintain muscle. It decreases blood pressure. These lists go on and on. It increases the water content of the skin, dilates small arteries. It is a natural antihypertensive. I'm just going through this to just pick out the ones that will have something to do with lipedema so we can move on. It enhances magnesium uptake and utilization. Magnesium can be one reason that people are overweight, because magnesium is used in every single every process that goes on in our body. It increases HDL, the good fat, by 10 to 15%, reduces overall heart risk of 40 to 50%. And let's see if it reduces homocysteine. Homocysteine is an inflammational hormone that goes up sometimes if we do have MTHFR, and it also causes breast cancer. It decreases the risk of colon cancer. It increases blood flow. It increases neurotransmitters, keeps the blood-brain barrier working. It prevents Alzheimer's. It is a natural antioxidant. It boosts NMDA receptors to maintain strength and durability of synapse connections. I'm going to go on. We don't need to go over all those, but just
Hey, Mom,
remember.
this might be a good time to mention, I did a post in the Lipedema Chats group, but if anyone doesn't know their MTHFR status and you've ever done 23andMe, or if you've ever done Ancestry.com genetic testing, you can go into your accounts and you can click download the raw genetic data, and you can download that to your computer. And then you can go to sites like LiveWello, LiveWello.com, or NutraHacker, or geneticgenie.org. And for just like $37 or $6.95, you can pop that in there. And not only will it tell you your MTHFR status, but it will tell you your COMT status and like bunches of extra genetic mutations. And it will tell you which supplements you might think about taking for those different genetic mutations. So that's just kind of a pro tip to get to learn yourself better and your body better. And it'll have things about nutrigenomics on there, like foods you should eat, foods you should avoid with your different SNPs and things that you have.
And I also offer genomic insight through Diagnostic Solutions that gets your SNPs and tells you, going by system, what you're at risk for and what to eat, not to eat, what to take, not to take, in order to optimize yourself. We don't have to be afraid of our genes. We just have to optimize them. Our gene is an easy fix. We just take methylfolate. And I could tell within 2 weeks of taking the methylfolate, I was a totally different person. So I'm going to show you the Dutch test. But first, I'm going to take you back. Remember the fibrosis, the first definition of lipedema, and I said it's a sinister pathway of estrogen. And I won't go through all of those terms, but it's the TGF beta that stimulates the fibroblast and all that to cause fibrosis. I looked up fibrosis. This TGF beta, that the toxic pathway of estrogen increases, causes, I found pulmonary fibrosis. There's pulmonary fibrosis. It also causes secondary changes of lymphedema by promoting fibrosis. And I'm showing you all these to make a connection here. It is my theory, and I cannot find anything on it, but it is my theory that it's what I'm going to show you that causes all of these issues of estrogen imbalance. And it's pulmonary fibrosis, it's the fibroids. I found, let's see, pulmonary arterial hypertension. The TGF beta causes that. Of course, the uterines, like I told you, even autoimmune thyroid diseases, TGF beta causes that. So what I have found out is all of the issues of fibrosis in our body, our lungs, even our breast, our uterus, if it's a fibrosis, it actually states that TGF beta is involved in that. And what is transforming growth factor beta in uterine fibroids. So now, since I brought you back to that, there's this many articles, so much research. I'm going to show you the Dutch test. This Dutch test does so much. This Dutch test, this I'll have to show you right here. This is going to look like something from a different planet to most of y'all, but this is the Dutch test. Can you see that? At the top, it has not only our, let's see, we're going to start with the second dial here. This is estradiol. This shows that this young 30-something girl is estrogen dominant. Her estrogen is through the roof. Her progesterone is not even halfway over. Her progesterone metabolites are low. Her testosterone is still high, okay? But very importantly, on this sheet, you see the diurnal cortisol curve. It's supposed to be high in the morning, taper off in the afternoon, then low at night so we can sleep. If this curve is too high, this is where stress comes in. What I was telling you about, even the psilocybin treatments. If this curve is too high or too low, it increases all-cause mortality. Okay, let that sink in a minute. So this curve, this cortisol, it affects your testosterone. It affects your progesterone. It affects all of your hormones. And if we have too much insulin, if we have too much cortisol, we have too much insulin also, which leads straight to that inflammatory process. Okay, that's the first page. I'm going to go to the third page. On this third page, we're going to go here to these dials. We don't have just one estrogen. We have three. We have estrone, estradiol, estriol. As we get older, estrone is the one that is higher. That's the one that it is thought to cause breast cancer. Estradiol is cardioprotective and neuroprotective. Estriol actually sits on the receptor sites and prevents estrone from sitting down, and it can block breast cancer. So we're going to look next at these arrows. These arrows going down is how this is metabolized. The first one you see is a blue arrow. This blue arrow is what I believe to cause proliferation of cells in our body. And I did pull up on AI that 16-hydroxy, this is 16-hydroxy, causes the proliferation. Well, it actually, there's a lot of research that says it causes proliferation of cells. This is where the endometriosis comes from. This is where the fibroids come from. And it also causes proliferation of bone tissue. It prevents osteoporosis, and that's good. But proliferation in other areas is not good. I pulled up research that shows this increases TGF beta, which is the one that causes the fibrosis in our tissues. So I believe it's just a matter of time that someone starts researching and says, this is the pathway that causes lipedema. If it causes fibrosis in our lungs, in our uterus with fibroids and breast cancer, it can cause fibrosis in the collagen bands in our legs. But the good thing is there is something we can do about this. The next one, if we are having this metabolite of estrogen, this is 4-hydroxy, this one actually does cause cancer. It can actually punch holes in the DNA, damage the DNA, and then in the rebuilding and the remodeling, that's where cancer comes from. The next one is 2-hydroxy. This is where we want our metabolism to go. There are supplements, though, that sway all of this over into this, but we have to know it first. If I had known about this when Brandi was a teenager, I would have started doing this on her once a year to test her hormones, see where they were, and get a hold of it before she had endometriosis, before she had fibroids, and before she had lipedema. So the next thing we're going to get onto.
Carla, I want to just jump just super quick, because that was one of the questions. I think that was the second question, was how do we help our daughters?
Yes.
So is this your recommend? Is a Dutch test, an annual Dutch test?
Yes. And at the end of this, I am going to address all of the ways, that we can help our daughters. But that is one of the things that can help our daughters, because we need to know this.
Right.
It is so simple. And we have seen with our patients, when we see this 16-hydroxy, and you don't want to give these things just randomly, because this depletes your body of other things that you might need, until you see this. And another one of your questions, I noticed, and this will answer it. Okay, I have been on bioidentical hormones for 15 years. 15 years. So natural medicine, my naturopathic doctor, Dr. June, I'm so thankful to her, because I wanted to go on bioidentical hormone therapy. I had breast cancer. A plain doctor, after I told her what I wanted, she just said, no, appointment over. No, not even a charge. But I knew, remember Suzanne Summers? She talked about natural hormones and the 7 dwarfs of, I forgot what she calls it. She went down the list. She was right. And I had listened to her, and I had researched. I knew I wanted to do bioidentical hormone therapy. And Dr. June, the way natural medicine looks at it, natural and anti-aging, Dr. June is the one that told me to go to A4M. The one that did her preceptorship in cardiology teaches with them and wrote the whole chapter on cardiology. So she knew what they did. So after the MTHFR was found and it made such a difference, I told her, this is what I want to do as a nurse practitioner. And she said, go to A4M. So now I've taken so many classes with them, and what they teach in the metabolic endocrinology, that's what this is. It's the metabolics of our hormones. And I went to endocrinologist 2 years ago. I had some issues and they sent me to them. They don't do this. This is a simple test and we can look at it, but this is the only way I would diagnose bioidentical hormones to a woman that has had breast cancer. That was one of your questions. Yes, and Lindsay Berkson, she wrote Smart Women, Safe Hormones. She's one of our instructors. She's actually does research, and she wrote that book. She had breast cancer. She started hormones 2 years after having had breast cancer. Now, if I look at someone's Dutch test, and they have this low, if their 16-hydroxy is low, I would start them on bioidentical hormone therapy without a worry. But I would want to do another one in 6 months. I would want to see how they're metabolizing that estrogen. I would want to make sure that it's going. And what I would do with her, the supplements that we give to sway this in the right way, I would want to give her those, see how she handles them, because I think that the progesterone is so protective. I think that the estrogen does so much. If it weren't for my bioidentical hormones, I would not be doing a practice at 68. I've worked in the healthcare profession for 46 years.
Yeah.
I was a lab tech for the first 14 years of my career, and now RN for 31, and now I started this practice 2 years ago. But on this test also, this gives us an indication of how you're using your cortisol. If these dials are all the way to the top, we might think you have they're hyperthyroid, or if they're too low, we might think you're hypothyroid. That's when we would, of course, get a complete metabolic profile or a thyroid profile and check it out. And all of these values come out. But one of my favorite parts is on page 6, we get our dopamine metabolites. So as an ICU nurse, when I was working in CVICU, and we've got our post open heart patients on all these critical drips, one of them is dopamine, and my heart rate has always been very low. So I looked at that dopamine. They'll give it to increase the heart rate and blood pressure. So I would think, is my dopamine low? And then Daniel Amen, he does scans of the brains to see if you're ADHD and or OCD. And I started listening to him, and he talked about the low dopamine. And of course, then Huberman does a lot on dopamine, but then through my education and pulling more of it out, it tells our melatonin level. Melatonin is the opposite of our cortisol. Melatonin is very important as to maintain the diurnal cortisol curve, because melatonin helps us sleep, but more importantly, it is an anti-tumor, anti-cancer hormone. So it helps prevent cancer. There's even research, and they give it to, there's one research, we can't take too much, it'll give us insomnia. But 1 milligram, 1.5 milligram is okay. But this test tells us so much. And
were you
yeah.
Planning on going into the things we can do to fix our cortisol curve?
Yes.
And if would this be a
I'm
good time to talk about that, since mine was really bad and I fixed mine naturally.
Yes. And mine was really bad when I came off of night shift. I actually have it. It's on the other end of my counter, but just believe me, my cortisol curve coming off of night shift, even 6 months later, it takes us a long time to work and on that cortisol curve. Mine wasn't only flat. About 9 a.m., it went completely down. And remember, I said it increases all-cause mortality. It completely went down. It only came up a tiny bit. I did not have a good curve at all. And Brandi's used to be low. But if our
mine was very low, like, because she actually tried me on the bioidentical cortisol for a while. Mine was so low, but I didn't like how I felt on that. And so I started doing the natural stuff. So I don't know if this will be a good time just to give people tips.
Yes, actually, taking adaptogens, there's a lot of adaptogens like ashwagandha. It actually adapts in whatever we need. But the things that I mentioned before, to do in the morning to get your dopamine up, those same things apply to cortisol. because your goal is high in the morning. So if you jump on that trampoline, if you stress yourself a little bit in the morning, licorice tea also, if you don't have a high heart rate, licorice tea will get your heart rate up and get your cortisol up in the morning. And then in the afternoon, just be aware of this cortisol and dopamine, because in the afternoon, you're wanting it to go slant down and be even kill. And so no stressful conversations at night. If you need to have an argument with your boyfriend, don't do it afternoon or night, and teach him the importance of this too, because that cortisol peak in the afternoon or night, it raises it up so high. And this is what is going on. One example, people that have sleep apnea. Now in ICU, I would actually see my patients' oxygen saturation dropping. And I would know, I'd see it on the monitor. And what they do is they actually stop breathing with sleep apnea, but their sat goes down. Then they have a huge peak of cortisol, and that cortisol makes them wake up. And then if it's one of these people, then they have that horrible thing when then they start breathing again. And that's what causes that. So, but things in the morning to get your cortisol up in the morning.
Yeah, the two things that finally fixed mine, because I don't know, Mom, if you remember, because I got my cortisol tested the first time when I was 25. I'm 39 now. And our naturopath, Dr. June, she tested it and she said, you have the cortisol levels of a 50-year-old. She said, this is usually the cortisol pattern. She said, they're so low. This is usually when people come in with chronic fatigue around 50. And here I am at 25. So she said, your cortisol had started going, this had started when you were about 10. That's how long ago this starts, because it starts about 15. Once you're in stage 4 adrenal fatigue, it has started 15 years before. And so there are different stages. So I was all the way at the end where my cortisol was flat all day long. It didn't peak ever. A lot of people have it where it's low in the morning, then it peaks at night. And mine didn't even peak at night. My cortisol wasn't working at all, which is why she wanted to put me on a little, because you feel horrible when you wake up and you have no cortisol. You feel nauseated, like you could go throw up, and you're kind of like dizzy. That's one of the symptoms. You have really low cortisol in the morning. And I tried all the adaptogens, because she gave me adaptogens for a long time, the ashwagandha and the lemon balm, and those did like nothing for me. It was not until and I like those like at night when you're relaxed, and I take those now, but when you're in like severe stage, I had to be so strict about my circadian biology. I would get up every single morning. Before I looked at my phone, I would go outside and sit for 10 minutes towards the sun, make sure the sunlight got in my eyes first while I grounded. And then when I come back in, because we got this from Dr. Jack Cruz, who's a neurosurgeon, he teaches this stuff. And when I come back in, I always wear, like when I'm sitting around during the day on my computer all day working, I wear these yellow glasses. As you can see, they're not, I lay off like on Zooms, but I wear the yellow ones. And actually I completely like cover up, like I'll wear a hoodie and I'll zip it all the way up on my phone or my computer so that it protects my thyroid, because your thyroid is so surface level under your skin that the blue light just destroys your thyroid. So you want to keep that covered up. And then I'll go back outside around midday. And no glasses, no sunglasses. Sunglasses are cute, but they're really bad for you because your body can't tell what time it is when you go outside. And so I get the bright light midday. I try to stay out as long as I can, like 30 minutes to an hour with as little clothes on as possible. So you want to do like the opposite of what everybody does. Most people cover up and slather chemical sunscreen on to go outside. And you want to actually take your sunglasses off and not have chemical sunscreen on. And you want to get as much of your skin, your skin is a solar panel that tells your body what time it is and your hormones what time it is during the day. And so, but when you come in and you get on these computers or your phone and the bright light from that is going in your eyes, it is 1,000 times stronger than the sunlight. So your body thinks it's solar noon all day long if you don't have glasses on. So you want to actually cover up when you come in and put your glasses on. And then at night, I go watch the sunset for at least 10 minutes. I usually take a longer walk, like 20-minute walk. And when you come in for that, then you want to put the heavy duty guys on. You want to put the red blue light blocking glasses on, and you want to leave those on all night. And you can also set your phone to where it doesn't emit the blue light at night. It's red. And then I even have red lights in our nightstands, like the bulbs that are in the lamps of our nightstands are completely red at night. So once we go back to bed, that's the only light on is the red light. And then we have these on if we're going to look at our phone again. We always have the red light glasses on. That is the only thing that finally fixed my cortisol patterns to get them a little way up. And they were like, kind of like, okay, you're out of the woodwork a little bit. This still isn't great, but like you're out of the woodwork a little bit. And then when I went to trauma therapy, that's when we saw my cortisol patterns get totally regulated. So I recommend that everybody because like Mom said earlier that she had breast cancer when she was 29. I was 3 months old. So you inherit your parents' nervous systems when you're a baby. So the first 2 years of your life, whatever your parents' nervous systems are doing, no matter how much they might try to protect you from things, you still inherit them. So for the first 2 years of my life, Mom was going through breast cancer, and my dad was thinking he might be a single dad and having to raise me on my own. And like, that is not a good thing. So he was freaked out. He was freaked out too. And so it doesn't matter how hard your parents tried, you still absorb your nervous systems if they're stressed. So if you go to it, you might not know, you might not think you have bad experiences from childhood, but if you go to a therapist, and if you're Christian, if you're a Christian, go to a Christian trauma therapist so that you don't just talk about it, but they actually have practices to move it out of the body, because it's stored somewhere in the body, and that's what's causing a lot of that. So those two things, being diligent about my circadian stuff with my glasses, and then going to a trauma therapist, completely healed my cortisol patterns completely. And now they're like, great.
Beautiful. I can't wait to see your Dutch test this year.
I know, me too. But
Because even if you don't think that this cortisol curve is that important, long-term stress, when you first start it, this curve will be high, very high. But then it turns into chronic stress. That's when it hits rock bottom. And my whole goal when I had breast cancer, my whole goal was not to let Brandi feel stress in my body. And that was like, she helped me because I was determined, to enjoy my first baby. And, but like she said, it's still picked up, it is still picked up. But going back to is, if you don't believe, what my goal is today is to let you realize that diurnal cortisol curve stress leads to this. This is what stress does to a fat cell. It turns a normal fat cell into a inflamed white adipose tissue. And this is exactly what a lipedema cell looks like, with all of that in there. And it causes more aromatase, which causes it to get bigger. They get hard because of the fibrosis. The fibrosis is caused by this toxic pathway of estrogen. This is what I looked it up on AI, and they came up and said fibroblast growth factor is more and more being indicated in lipedema. It came up on AI, and but I picked it up, the actual research. It has to be this. It has to be this high of the 16-hydroxy. That's what caused it, and all of those other fibrosis. So getting back to what we can do, and I type this, I don't know about you, but once that pathway is seen, it cannot be unseen. And doing this Dutch test is what helped us see Brandi's, it's what helped me see mine, and it's what helped us get level and regulated. And but my approach to lipedema is multifaceted, and we have to protect our daughters. I use evidence-based medicine, and you have to consider the individual clinical experience of the practitioner, which I have seen it. I've had it personally. I've seen it in my daughter. And I know by that Dutch test exactly what is happening. But then we have to consider the patient values and expectations. First, we address the circadian rhythm. We have to teach them as they're growing up, just what Brandi was teaching. And Brandi is the one that taught me years ago about the blue light blocker glasses and that artificial light at night. And I was flying back to California from Tucson, and I sent her a picture of me sitting in the airport with my hoodie on and my blue light blocker glasses. But that is so big. You're protecting your melatonin, which is a anti-cancer, anti-tumor hormone. When you a good day, waking up in the morning with good cortisol depends on a good night's sleep. Progesterone helps us sleep. Progesterone starts going down in our 20s. We have to protect our sleep. When we're sleeping, Matthew Walker wrote that book, While We Sleep. He says our brain is being bathed in all these neurotransmitters, the dopamine, the norepinephrine, they're flowing in and out of our brain. And that's when we're reinforcing everything we learned in the day. So if we've had a good night's sleep, it's just like getting out of a hot bath. Our brain says, okay, we've got energy to go. And that's when our cortisol is coming up. That's when our dopamine is coming up. The cold water, the jumping, I used to, before I found out about exercise, I would wake up and it would feel like my brain just can't get going. And I had to start exercising in the morning. I do the rebounder. I do the sunlight in the morning, and I do my actual workout as soon as I can in the morning. I still run for 30 minutes every day. I do the weights, and I do flexibility, cardio, and all of it. We have to address the inflammation. And we went all over all that. We have to address the hormones and the metabolites of those hormones. The Dutch test to be sure we're detoxing our body. Even being constipated can actually cause us to be overweight, because our gut is phase 3 of detoxification. This Dutch test checks phase 1, phase 2. It checks to see if the COMT is working out as detoxing. And if not, we need to do a genetic test to see what's going on. But if stage 3, you can look at stage 3 like that's the drain on our hormones. It's got to get out of there. If we're constipated, it's not going anywhere, and it's going to recycle those metabolites. Okay, a micronutrient, and teach them how to eat. We do not need to eat seed oils at all. The only fats we need to eat are avocado oil, olive oil, and coconut oil. I cook with avocado oil spray, and you can cook in the air fryer. Their kids are going to do what we do, and tell them why. And the first class of my integrative cancer classes, no seed oils, because they know. And the order, believe it or not, the order that we eat our food can either decide inflammation or no. And Barry Sears wrote the book, The Zone, in the 90s. And this was my first exposure to, hey, we can actually fix our hormones. And one of my last patients, her complaint was, if I eat bread, I'm down for hours. This is the reason. When we eat carbohydrates first, we have 2 stages of insulin release. The insulin crystals on the outside of our pancreas come out to prevent us from having a high blood sugar. Insulin is a storage hormone. It shoves everything into the cell. It's like, get in there, get in there, get in there. And that's what insulin does. But the worst thing is the downstream effect. It's like a domino effect. The downstream effect of insulin is all of these inflammatory cytokines. If you eat your protein first, instead of insulin, you're going to release glucagon. Glucagon goes to your fat cells and said, come on out. We don't have, in the absence of insulin, if we've already got high insulin, not so much, but glucagon says, come on out, we need you for energy. And the downstream effect are all the good hormones that fight disease. And the one reason that this is so important to me was because I felt horrible after eating all the time. And in the South, you know how we eat. It's going to be fried everything. It's going to be a fried dessert too after a fried meal. And so I felt terrible, but I thought this is just another diet book. But in the preface, he says that all of the men in his family died in their late 40s or early 50s. And Barry Sears actually had more chemotherapy drug patents than anybody in the world at that time. He knew he had to start studying heart disease because he knew that he might die young too. His own dad died at 53. Uncles died in their late 40s. Even his granddaddy died. And he said, if you eat this way, you're going to decrease inflammation in your body. So every time you eat a bite of food, it's like, am I going to eat this bread with this olive oil? This carbohydrates is just going to push all that fat into the cells, or am I going to eat the salad with the olive oil? If you'll eat actually your olive oil on the salad first, olive oil makes the top of your duodenum release cholecystokinin, which tells your brain you're full. Then you start eating your protein. And after I started, he was my first exposure to hacking hormones. And that's when I fell in love with it. We were so excited. We talked about it all the time. Brandi even did her science project that year on eicosanoids. These are paracrine hormones that are used almost the minute they're formed. But I got to wondering about Barry Sears and saying, I thought, did it work for him? The man is 77 now. It did work for him. And he's like the head of the World Inflammatory whatever. And he's written several more books. So eating this way did decrease his inflammation in his body, and he's still alive. We have to address the circulatory system. Because of this, remember about the glycocalyx. And the glycocalyx that lets the fluid leak out of our vessels into our lipedema compartments is the same thing. I address that. I will be addressing that from now on. We got to restore the integrity of the blood vessels to decrease that, and we have to address genetics if you suspect something. And of course, that's where we get to our GLP-1s. GLP-1 semaglutide reduces the appetite, but it actually increases our dopamine signaling. It can increase dopamine levels. It can decrease a neuronal degeneration with the dopamine. It alleviates motor and non-motor features. It affects neuroinflammation. It affects oxidative stress. It creates mitochondrial homeostasis. GLP-1s restore dopamine in the brain to prevent the leakage from the fluid, from the blood vessel. And they also decrease, this is a biggie, tirzepatide increases adiponectin. Adiponectin is normally low with obesity. Adiponectin is a potent anti-inflammatory. They're neuroprotective, preventing Alzheimer's and Parkinson's. They help with PCOS. And adiponectin is really big. Adiponectin really, there's so much question as whether there are GLP-1 receptors on the muscle. Some research says there are, some says there's not. Some research says they affect the muscle indirectly. This is one pathway that they affect muscle indirectly by increasing adiponectin, because adiponectin actually does directly affect the muscles. It increases insulin sensitivity, increases insulin secretion. There was one study that showed that tirzepatide was associated with lower hazards of all-cause mortality, adverse cardiovascular events, acute kidney injury, and acute adverse kidney events compared to others. That was really good. And also the GIPR, the GIP that is in the tirzepatide, the agonist, actually increases the lipolysis of fat cells in the absence of insulin. And also the macrophages in the white cell, the macrophages in these compartments that increase all of this inflammation. The inflammation with lipedema is in those compartments, not systemically, but the tirzepatide. And also I studied that Protandim, and the Protandim with Life Advantage also decreases the fibrosis, and it also increases the macrophages in those compartments. Is that all?
Yeah,
I've got all that
This,
research.
might be a good.
I got research. That was a lot.
Yeah.
But I know y'all are glad I finally got to the end of my spiel.
I know there was
so-
like a lot more about GLP-1s you'd like to say too, and I just wanted to let everyone know that you and I went live recently in the Lipedema chats group. So if everyone wants to deep dive into the GLP-1s, and Kristen, I'm happy to upload that recording in your group also.
That'd be great.
Everyone, because Mom and I will go live in the Lipedema chats group here and there. So everyone's totally welcome to join. It's just Lipedema chats on Facebook.
Yes. Yeah. Yeah. I think just in respective time, just everyone listening back to the playback, like I know that we, just like Carla and I said early on, this could go on for days. Like there's so many pathways, and you know, it is really so incredibly important for us to understand this. And that's why having this recording will be such a valuable tool. But if you can share that GLP-1 recording, I know that's a piece. You know, the Dutch test, like I have 3 sheets of notes over here, and I've talked to you several times. So
yeah, it's a lot.
Well, just to sum it up, the compartments,
yes,
everything's coming in, but nothing's coming out. It's fibrosed. And stress can lead to all that. If we already have a genetic predisposition, not just the main ones, but there are indirect ones. I know everybody under stress does not cause lipedema, and I don't want the lipedema ladies to think it's their fault because they've got all this stress going. There's a genetic predisposition first, and then this, and that fibrose, that sinister pathway that is indicated in everything else I found the research on, but it does not come up with lipedema. But and what the AI said, it is indicated more often in lipedema, and but it needs more research. So we're just getting there. This is my hypothesis. If this sinister pathway of estrogen can cause fibrosis in the lungs, fibrosis in the breast, fibrosis in the uterus, that has to be the pathway with lipedema. And there are things we can do about it. There's all these things we can do about it. There's the supplements that we can take. And I know one person had asked about supplements, but I think that everyone, especially everybody, needs hormone balanced. We need our progesterone. We need our testosterone. We need our estrogen. That is one of the first things I do. I do hormone balancing. I check the thyroid, make sure that's optimized. But sometimes with the lipedema women, they might also have a thyroid issue. But once some of these, once they start losing this weight, it self-corrects some of these things. And sometimes the inflammation, goes away with that. But to do that, I put everyone on a multivitamin with selenium and zinc. That has a lot to do with your sex hormones. And I put everybody on magnesium because 80 to 90% of the population is low on magnesium. And I put everyone on chromium. And I've gone back and started doing that because the energy so many times can't get into the cell if they don't have chromium. And the rest of it is mainly based on what their tests tell me. Vitamin D3K2 is a must.
Yep.
And that, of course, is our
Magnesium, like you said earlier.
yeah. Well, yeah, the magnesium and vitamin D3K2 is a must. Those things I put people on most of the time, that's what, but if they've got labs saying otherwise, I might not, but those things are musts.
Yes.
And Bob, it hit me when you were talking, because you had mentioned the oxytocin in our chat earlier, but that was before everybody else got on here. So I thought I would just recap, because I thought that was actually super useful about the oxytocin, because that was before Kristen had actually let people in and started the recording that we had talked about that. So I thought everybody's going to be like, what? We didn't talk about oxytocin.
Tell them how it is, Brandi.
Yeah, but I was just going to recap that for everybody. We talked about how, men run better on stress hormones than we do, and women run better on oxytocin, which is why they often call it the tend and befriend hormone. And it's like more, instead of competition, like men like to compete, we like to collaborate, like we're doing now, right, on this call. And so we were talking about how there's so many different things with oxytocin, like it can lower your stress hormones. It can also, if you're taking GLP-1s, it can help you retain your muscle mass, because that's the thing with GLP-1s, you lose muscle mass. So we were talking earlier that to increase it, there is a specific type of probiotic, and I'll link that. I forgot what it is off the top of my head, because Tony and I just learned about that increases it, that you can take. And you can also get it compounded and take it like a nasal spray. But if you want to produce your own, Kristen and I were talking about the sigh that you can kind of just like go, and you make sure that it kind of vibrates your upper lip here, and that actually will help you produce oxytocin. So if you're stressed, you can do that. You can let out a really good long sigh, and that'll increase your oxytocin. So I thought everybody would think that our conversation was helpful before we started.
And I have a Huberman, a short on that I'll be sharing to my people soon.
Great.
It's just that perfect, everything weaves together.
Yes.
Right. And oxytocin works with the progesterone. They work right together. But there's a funny research that one of my instructors told about, and it was about the aromatase, Dr. Landa. She said there's research, and she cites it, that they exposed these, I don't know if it's hamsters or what, to stress and measured their aromatase. And so then they did that to see what happened, how long they would be stressed. And the male hamster, just pretend it was a male, the male hamster was only stressed for a few seconds. And then after sex, his aromatase was gone. He wasn't stressed anymore. But the female hamster was stressed for 30 more minutes. Of course, her aromatase, she was still turning testosterone into estrogen, of course, even after sex, and we know that. And her aromatase also went up when he was stressed. So that's the difference. Therein lies the Mars and Venus thing. If he was stressed, her aromatase was going up. So that's good to be aware of, because if your partner comes home at night and he's stressed for his job, then you're going to be stressed. Your cortisol goes up. You're turning your testosterone into estrogen. Just be aware of the people around you that are stressed and how that affects us. And women are so empathetic. That happens all the time. And sometimes we have to set barriers. Like, no, I can't talk about this right now, because if you do, the stress, your cortisol is going to be up, and you won't be able to sleep all night.
Yes. It's so true. Thank you both greatly. There's so much meat here. I'm so grateful for all of this information and the simplicity of, let's start our daughters with the Dutch test. Let's look for these cellular pathways, and we can start getting answers, our circadian rhythms, and honoring that.
Yes, the insulin is a biggie. The insulin Yes, eat and teaching them what happens when they do eat carbohydrates,
Yes.
because in that very first class, the first test that my integrative cancer doctors want to look at is fasting insulin, hemoglobin A1C,
Mhm.
and the C-peptide, because the insulin that they're taking in at long term, the insulin, the carbohydrates that they take in on a habitual basis are going to determine those levels, and they're going to indicate a higher risk for cancer.
So wild.
Not just inflammation and depression,
Yeah.
and I don't feel good, but cancer.
Cancer. Yeah, big. That's a big one. Yeah.
That's the big C.
Goodness.
Okay.
Well, I think that's it.
Yeah. I won't add anything else, I promise.
I don't, we're gonna let you keep preaching. So, you know. But thank you both. Thank you. Thank you. It's gonna take a minute for this recording to be completed and download, and I'll do all the behind.
Oh, sure.
But I'll have that up in a few hours, and I will share that out with everyone that registered for this call. So thank you so much. We're so grateful for your big giant brains, both of you, and your high IQs with your lippy legs. Yes.
Thank you, Kristen. Thanks for having us on.
Absolutely.
Thank you
Thank you,
for having
ladies.
us.
Bye-bye.
Thank you. Bye-bye.